Low back pain, what you need to know. Low back pain, often called lumbago, is a very common health issue that affects the lower part of your back, between your ribs and your buttocks. The discomfort can feel different for everyone. It might be a constant dull ache or sudden sharp pains. It can come on quickly or develop slowly over time, and you might experience it all the time or just now and then. It's a major reason why people experience limitations in their daily activities worldwide. Recognizing the signs, common symptoms of low back pain. If you're experiencing low back pain, you might notice some of these common signs. The pain itself. This can range from a mild, persistent ache to intense stabbing or burning sensations in your lower back. Pain spreading. Sometimes the pain can travel into your buttocks, hips, and even down your legs. If it goes down the leg, it's often referred to as sciatica. Stiffness and difficulty moving. You might find it hard to bend, straighten up, or move your back, especially when you first wake up or after sitting for a long time. Reduced flexibility. You might not be able to move your back as freely as usual, making everyday tasks difficult. Muscle spasms. Your back muscles might suddenly tighten up and feel very painful. Changes in posture. You might find yourself not being able to stand up straight or leaning to one side without realizing it. Numbness or tingling. You might feel a pins and needles sensation or a lack of feeling in your legs or feet, which could indicate a nerve issue. Weakness in the legs. You might notice that your legs feel weaker than usual. Important warning signs. In rare cases, problems with bowel or bladder control can occur. If you experience this, seek immediate medical attention. Finding answers. How low back pain is diagnosed? To figure out the cause of low back pain, healthcare. Professionals usually follow these steps, talking about your health history. They'll ask detailed questions about when your pain started, what it feels like, where it is, what makes it better or worse, if you've had it before, and your overall health. Physical examination. The doctor will observe how you stand and move. Check your back for tenderness or muscle tightness and test your range of motion. They might also do neurological tests like the straight leg raise to check your nerves, using imaging when necessary. For recent mild back pain, scans aren't usually needed right away. However, if there are signs of a more serious problem, or if the pain doesn't improve, they might order x-rays to look at the bones in your spine for fractures, arthritis, or alignment problems. Mr. I. This provides detailed pictures of soft tissues like discs, nerves, ligaments, and muscles to find problems like herniated discs or nerve compression. CT scan. This can give cross-sectional images of the spine and might be used if an MRI is unsuitable. Sometimes a dye injection is used with a CT scan for a clearer view of the spinal cord and nerves. Other possible tests. In some situations, other tests might be helpful. EMG and nerve conduction studies to check how well your nerves and muscles are working, especially if nerve problems are suspected. Blood tests to rule out infections, inflammation, or other medical conditions. Injections for diagnosis. Injecting numbing medicine into specific areas can help pinpoint the source of the pain. So if you're facing low back pain, remember you're not alone. This is a widespread issue. Understanding its signs, causes, and available treatments is the first step towards finding relief and getting back to living your life comfortably. So if you found this video helpful, please don't hesitate to share it with your friends and family. And if you'd like to learn more about health and medical topics, stay tuned for more updates. Until next time, take care of yourself because you're worth it.